Okay, hi everyone, and welcome to our first webinar hosted by Future Athlete Lab. My name is Ava, and I'm one of the co-founders of Future Athlete Lab.
Hi everyone. Thanks for joining today. My name is Jovita, and I'm another one of the co-founders and the director of social media.
Hey everyone, my name's Nathan. I'm the Director of Business Development here, and I'm very excited to host this webinar. So, yeah, thanks for everyone who tuned in.
We are thrilled to have you here today as we dive into crucial topics that can enhance athletic performance and ensure the safety of our athletes. Today's webinar will equip you with valuable insights and practical strategies to help you stay safe while pursuing physical activity.
We're so honored to have two incredible guest speakers joining us today, Ava Cheng, a physiotherapist at a Hong Kong sports clinic, and Arthur Jit Wong, an experienced basketball and volleyball coach.
So, we'll start off the webinar with Ava Cheng's talk, followed by a short Q&A session, and the same will go for Jit Wong's talk. So, thank you so much, Ava, for your participation and your willingness to share. So, you can start your presentation now.
Hi everyone, and I'm Ava, and I'm working as a sports and women's health physio in Hong Kong Sports Clinic, and I'm glad to present this topic to you. And I'm sure all of you who have joined this webinar must be very active and then engage in a lot of sports activities. And there's a lot of adolescents or young people who train with us as well, and they got a lot of injuries, and then I would like to share and teach you guys how to prevent it. So let's start off with some introduction of myself. Okay, so I actually mainly focus on a lot of sports events, and I would do on-field work, and especially for preventing injuries for basketball and also football team. And I'm also working with women who are pre and postnatal, and also young ladies who have issues with pelvic floor, especially when they have menstruation pain, or they have some weight management issues when they have engaged some sport which is related to weight control, such as taekwondo or jiu-jitsu. Yeah. So today we mainly focus on four topics. Let's start from the introductions. Actually, I'm not only physio, I'm also a PE teacher. I worked for 1 or 2 years as a PE teacher a few years ago. And so I just want to say sports, this is my favorite quote for me, because I think like sports do have the power to change the world, and it has the power to inspire, and it also has the power to unite people in a way that little thing does. So that's why I'm really glad that I have the chance to speak to all of you today about sports, and how physio can help with can help you to engage your sports safely. And first, let's start from the introductions. So I think maybe most of you think that treating an adult and treating as young people might more or less the similar. Like they have the same ankle sprain, they have the same similar sports injuries. But for us, actually, treating young people is somehow very difficult for us, because you guys are just different. You are not mini adults. You guys have different pathologies and different anatomical structures compared to adults. So I just want to talk about how you guys are different and why we treat you guys differently. Okay. So about the differences, I would give just several topics, but generally, the first thing is that you guys are in a stage of growing. Okay, so in puberty, you guys grow taller, generate the size, and then the hormones are so different. So especially for girls and boys, okay, you guys experience rapid growth, and it would lead to the temporary muscle and tendon imbalance. What does that mean? It's because the bone keep growing, but then our muscles can't catch up with the rate of growth with the bone. So while the bone is growing, but the muscle is like growing slightly less than the bone, so it got really tight. and somehow the growth rate of the bone is way too fast. So somehow the muscle would got pulled, or the tendon got really tight, and then it would kind of pull the bone to the other side, and then it would cause deviations or deformity. Okay, so I will explain some with example later, but that's what you have to understand why people generally have tightness or muscle strength over the hamstring, the back of our thigh, or the front of our thigh, and when we are at that stage, especially for a sprinter or a rugby player. Okay, another thing is very important why we have to treat it really carefully is that you guys have an open growth planes, which is your bone, when we hitting to specific spots of that bone, the bone can just stop growing. So we have to be careful to see if you guys have some contusions or involved in some contact spot, and then you got fracture. We have to be very careful the fracture site isn't involved the growth plane. If they involve the growth plane, it might affect the height or of your the height, and also the causing imbalance between both legs or both arms. So we need to be very careful, especially for boys. If you got maybe you got contusions over the knee and the growth plane is actually near that area. So if we didn't treat it carefully, the leg length discrepancy will be quite large, and it will affect the appearance and also the sports performance. Okay, so the next one would be the bone, again, about the bone structures. What we talked about, the growth plane, the bone grows faster than the muscle. The other thing is that the flexibility of the bone is different. So for adult, our bone is kind of rigid, more rigid, not rigid, but you guys have more flexible bone than us. So the fracture is actually different from us. So it takes longer time to heal, and also we need better fixation to do for that. And again, so it would involve two different kind of fractures that I will mention later, but you guys just need to know three things about the bone. You guys have at the growing stage, bone grow faster than the muscles. And the second one is the growth plane sites. If you got injured, it will got the leg length discrepancies. The leg length will be different and affect the height and appearance. And also the third thing is the fracture would be very different, and then it would take longer than the adult to repair. So, and what I'm trying to say in this picture is, look at the left one is the younger kids, maybe toddler. You can see the ratios is very different. You can see they have a bigger head, and that the trunk and the limb proportions is around 50-50 or 60-40. But when we grow older, and actually our head is much smaller in terms of the ratio. So what would be the effect for that is that our weight, our center of gravity would be different. So if it's taller, the center of gravity tend to be lower, and then if it's adult, the center of gravity would be higher. So the whole mechanic would be different in terms of training and also for the injury mechanism. So even you guys do the same sports, we analyze the movement just differently because the ratio is so different. So, and this is what I just mentioned is about the growth plane. So about this picture, this is actually our knee, and this, what I'm trying to show is the fibula, this is the tibia, and this is the thigh bone. And here is actually, you can see from this picture, this is younger, and this is what adult here. You can see when the kids, they have a two bone separated, but when we grow older, they fuse together. So that's what we call the growth plane right here, the line. So the bone mainly generate the cells and then bone formations at that lined site, okay, in this site. So this is the growth plane. So whenever it's involving some joints like elbow, the knee, we have to be careful whether the fracture site is near the growth planes. Okay. So about the other things, okay, these are the major things because usually sports physio mainly focus on the bone and musculoskeletal. So that is the three things we are looking into. So about the other stuff that you guys are indifferent is that you guys may have some weaker or coordinations than the adult. That is not because of you guys are younger generally. It's because your brain to muscle development, the connections, the circuit is not as well developed as adult. So when you're doing some coordinated movement, somehow it's really difficult for you guys to learn it because the connections to the muscles and the circuit is just not well developed. So, well, I want to talk about some common injuries that you guys may face and what we can do about it. Okay. So the first one you need to learn about sport injury is what we have in our body. So this is the main categories for sport injuries. First, if you have bone. If you have bone injury, which means you have fractures, okay, which means the bone breaking down, and it have different type. And for joints, somehow you dislocate. The most common one you guys may experience is when you're playing basketball, you have dislocated fingers or shoulders, and somehow some kneecap dislocations is quite common in adolescents. And for the cartilage, somehow it got tear, especially for knees. Okay, it combined it with some ligament injuries. And for muscle, they tend to have strain, which means tear of the muscles, and have different grade. And the tendon is actually the structure which attach our muscle to our bone. Okay, so this is the thing that you guys need to be aware of because as I mentioned, the bone actually grow much faster than the muscles. So the tendon tend to be pulled because the tendon attach the muscle to the bone. So it got they get a lot of stress during the process. So they have tendinopathy, tendinitis, or even tear during the process. And the next one is ligament. Ligament hold our bone together. They are like a glue stick or glue or like a stick to which place our bone to bone together to allow our bone to move. Okay, and the other one is the last one would be skin, just abrasions, just maybe some contusions when you involve some contact sport or some rugby and ball game, you guys will have abrasions. Or for long distance runner, the abrasion actually happen with the shoes. Okay, after long distance running, the skins wear off and then they will have abrasions. So very commonly, just general injuries. For basketball players, you will have finger injuries, as you see in the photo, and then you will have jumper knees, okay, which means when you're jumping a lot, and if your hip muscles is very tight, or your lateral thigh is very tight without much stretching, or even when you guys stretch, okay, but your muscles is just way too short comparatively to the bone, it would cause the jumper knee. And also you have the ankle sprain and also the jumper heels that I will mention it later, which is for the calcaneus, which is the bone at the ankle. So for football, you will commonly have pulled hamstring because you use a lot of force to kick out the ball. So when you kick the ball, and while your front part of the muscles, like the front part of your thigh is very strong, while the back of your thigh is way too weak, and then it will just pull the hamstring, which is the back of the muscles here. And somehow you'll get contusions, some knee injuries because they have a lot of twisting and change of directions, and they also have the groin strain because you guys have to go all the way to the floor to catch the ball, and of course ankle injuries. Okay, So after what I have told you just now, I just want you to remember what we need to do, what we know about different stage. So after the injuries, what would be like, okay? And there's actually 3 stage. The first stage is the acute stage, which means from the second you have the injuries, then you will to the 40 to 2 days to 3 days, okay, 2 to 3 days, I would say. The sign and symptoms might be keep increasing, okay? And what will come later would be the subacute stage. It would be around 7 to 14 days. And this stage, the symptom wouldn't be increasing or exacerbating. It would keep stable, but then maybe gradually get better with less pain and less swelling. And for the chronic stage, it's actually come from 14 days go all the way up to years. It's because in chronic stage, if you don't manage it well, it would recurrent injuries. And also your body is very smart. If it's painful, you will have some compensations, and it's exaggerate, and the pain will last for years. That's very, very common. Just an example as ankle sprain, okay? And acute stage, you have painful ankles, and then you avoid stepping on the floor, and then you lean on left side, and then much less force what it is leaning on the right side. And from time to time, as because the muscle is very imbalanced, and so when you involve some high intensity sports or when you do some weightlifting work, the ankle will feel the force or the muscle is imbalanced and will cause long-term problem after that. So this is some photo for the sports injuries like you guys might have experienced. This is the dislocated little fingers. And also, this is some fractures. Commonly, you guys might know fracture as a broken bone, but it's not only caused by some traumatic force or some maybe some greater contact force for that. Somehow it would accrue force time to time, and especially for long distance runner, the force is actually generate internally. What I meant is they have a lot of stress during the process, and then our tibia, this is our shin bone, accumulate a lot of stress in this region when they're running. So for after a long period of time under stress, it would just have what we call a chronic fractures. Okay, so the young people would have pain over the shin bone, and then it not going anywhere, and whenever she went for 20 minutes or 30 minutes or run for 10K, the pain just starts and never goes, and just recurrently. So in this time, we could suspect that there might be some fracture that actually happened in our tibia without any traumatic force. It's because the stress is accumulated during running or during intense training, and most commonly is long distance runner or some track and field athletes, because they practice a lot of running and use a lot of jumping force, which cause a lot of stress to our shin bone. So this is also the common side of stress fractures. The second toe and our calcaneus, and this is our tibia. So whenever you experience some pain over these sites, and then it's came on and off, and then you can't resolve it, then might be that you might consider this as, do I have a minor fractures, or is it too much stress during the training? What can you modify that? And usually these things actually happen when your muscles is imbalanced or your mechanics during your training is not appropriate. So from this time, you need to readjust the dosage of your training, and you also need to revise what happened to your body mechanics. Do I move my leg too far away, or which part of the body is not moving, and then I compensate a lot of using other things. So this is a thing that we have to consider. So this is the injuries. So in this picture, I just want you to know that in injuries, we have 4 basic symptoms in our acute stage. One is pain, okay? Another one would be redness, swelling, and also bruising, okay? So this is the symptoms and sign for acute injuries. So a lot of time, once the injury happened, we have ice pack, but you shouldn't have the ice pack for too long, because the ice pack supposedly to suppress the swelling and also the internal bleeding. But if you place it there for too long, it would what would happen is that the ice would induce more blood flow to the injury sites. So remember, if you have the injuries or if you have ankle sprain, don't place it more than 20 minutes. 10 to 20 minutes is perfect for stopping all the swelling, and then it can help relieve some pain. So these are some more information about different type of injuries. So for specific type injuries in adolescence, what I've mentioned, and I will just generally go through it. And this is what we call the green stick fractures. Is that you guys, the bone, and the bone is very flexible. So instead of just breaking it down into 2 pieces, you guys would have a green stick fracture like this, not like completely fracture, but it's just maybe 50% and with some 50% and only on one sided, okay? Because you guys have a good flexibility of your bone. Another thing is what we call the bamboo stick fracture. As you see in these pictures, okay, the fracture size is also only on one side only, but not on both sides or completely fractured. Okay, so that is the fracture, and the fourth one is actually very, very common in your age, especially for basketball player, soccer, or even fencing player. That what we call the Osgood-Scharlac's disease. It's happened in the knees. So what we would see is actually they would complain of a lot of knee pain, and then their shin bone would have a very prominent protrusions near the kneecaps, and that is the growing part of the knee, because as you remember, I've mentioned the muscle actually pulling the bone. So this is the tendon right here. I'm pointing with my pointing here, and then this is the patella tendon. And then what is attached is actually the shin bone. So what happened here is it because your quadriceps, the thumb of the thigh muscle is very strong and too tight, it was actually pull the bone off your tibia, and this part was actually protruded and keep of rubbing on the patella tendon. That's why your knee pain keep recurrence, okay? So it is very, very common that we see in the clinic. And another one that is the same theory, but just at different sites, is on the ankle. It's because our calf muscle is very strong and the tendon actually pull that little bone off from the calcaneus. This is our heel bone, okay? The calf muscle is very tight, and the stress accumulates to the tendon and to our bone, and actually pull a little bit of our bone out, or make the bone actually deformed it and protruded and keep accumulate the stress here, and then it would cause painful when they walk or even they jump and whatever activity involve our calf movement, okay? So these are the things that I have mentioned above is mainly about musculoskeletal, which is about muscles and also the bone injuries. And the last thing I want to mention is female athletes triads, because I'm a women's health physio and I do want to let you guys know about the female athletes triads. It's because I used to have it when I was young because I was a taekwondo athlete and I have to control my diet throughout my puberty, and then I don't have menstruations by that time. I was super unhealthy, and that's why it's a kind of affected me until now. So for what is a female athlete triad, is the syndrome that interact conditions that affects the adolescent females and with low energy available. You will feel very tired all the time, and then you might you may have eating disorder or you might not have, but these two syndrome is actually correlated to each other. So what would be the symptoms be like? Is first one would be menstrual dysfunction, which means you have really painful period, and then you have lower back pain before and after that, and then you have pelvic pain. And the other one would be low bone densities, and also you might not have period at all because of your body fat is too low or your hormone is just disrupted. It is because of excessive training and also because of inadequate calorie intake. And this is the symptoms will be like is that you will feel very tired, and then you will have fracture easily, and then you will have you work really really hard, but then you just can't meet the standard of yourself. It's because your body just can't take it. So for this kind of symptoms, if you have it, you need multidisciplinary management, which means it involves medication, nutritionist, physio, and counselor to support as a whole team to get to solve the problem. So this is what we have here. As you see, it's around 80% of female high school athletes actually meet the criteria, which means you are trying to lose weight because of the competitions, and then your menstrual cycle is disrupted, and then you don't know, but your bone mineral density is actually very, very low, and then you will get stress fracture very, very easily. So this is the common things that I want to mention. So for the management, as I want to say, it's just PRICE protocol. For the PRICE protocol, is first thing you need to protect, okay? Which means take rest and then just protect the injuries area to prevent further damage. If you are in the basketball court, what we have to do is moving the athlete to the safe side, or just protecting the injured athletes. If it involves any bone injury or spinal injury, don't move it if you don't know what happened to the bone. And the next step would be rest. Avoid any activity first to prevent worsening the injuries. And apply ice. Remember, it's 15 to 20 minutes for every 2 to 3 hours. It helps really reduce pain and swelling and inflammations. And the next one would be compressions. You can use elastic bandage or just pressing in with your ice. Use ice pack to press the injured side with your hand. And the next one is elevations. And how tall do we have to elevate is usually if you have hand injury, just elevate above your heart level to promote the blood flowing to your heart and then to reduce the swelling as well. Okay, this is the idea that if you raise the injured part higher than your heart, and then the blood it would be difficult for the heart to pump all the way to the injured side and back. So there will be less swelling over the injured side to prevent excessive swelling or inflammation happening there. And although this is the most common protocol that we use nowadays, but there are lots of new protocol like peace and love and also police, this kind of protocol, which means which actually involve a lot of optimal loading, which means don't completely rest during after injuries. You need to have some loading or some movement allowed it to promote healing. So instead of rest, so what physio do is we know that if you got injured, what we need to do at that stage, and what is allowed it to move to pulmonal healing rather than just rest, because resting would causing the joint to be very, very stiff, and then it would actually cause it, and the performance of the athlete actually drop a lot after 2 or 4 weeks. So if it's a professional athletes, 2 to 4 weeks is actually very, very it's crucial for that, for their sports performance to build up, if they rest for too long, for around 4 weeks. So this is what we have in our first aid kits, and then this is what I have as a on-field physio. As you know that we have a bandage to prevent, this is a rigid tape, the white one here. Okay, and then we have the elastic one tape, the spot taping for the muscles, the rigid taping usually for the ankle and the shoulder or elbow. And we also have the some first aid thing, the bandage, and also some cotton wool and also very important is the ice spray, ice pack, and the massage oil here. That's what I would do during the on-field day. I would prep all the thing into the competitions, and then if they have anything, I would just use these tools to help them prevent some injuries or recurring injury, especially for ankle and knee. And then if they have any muscle cramping during the process, I will also do massage for them, and then to facilitate the performance on that day as well. So that's it. I think I hope you guys know more about your body, and I hope you guys, if you know what if you got injured, you know where to seek help, and also if you got pain at that specific site that I've mentioned, you may be aware of that. So, and thank you so much, everyone. And I think that's my presentations.
Thank you so much for your presentation, Ava. We're gonna open up the floor for some Q&A questions now for 5 minutes. You can feel free to just like unmute and ask, or you could type your question in the chat. Thanks. Okay, we have a question in the chat. It says, "Hi, how is it possible to address muscle imbalances due to injury from a long time ago?"
Um, Thank you so much for the question. So I think it depends on the size of the injuries. If it's for lower limb injuries, that what we do is look into the movement. If you do squats or do some hill lifting, we will see whether your body actually shift to other side, and how is it possible for us to get into the balance state is that we would observe the movement during the training, and by time to time we will remind the athletes to try to go back to the center, and then or shifting the weights more to the other side to just generally and progressively increase the weight to the injured side, and to prevent the muscle imbalance. So usually for muscle imbalance, I think it takes 4 weeks to 12 weeks to adjust it. And it also depends on how long already you have developed the muscle imbalance. Does that answer your questions?
We have another question about how can an athlete differentiate between normal soreness and a sports injury?
So for normal soreness, especially, I think you mentioned that it's a muscles pain, I suspect, right? So a lot of the time after training, we have muscle soreness, and some people would say it's because of lactic acid, that's some waste accumulated in the muscle which cause soreness. But actually, what we found in the latest research is that the soreness is actually coming from the minor tear in our muscles. So when you feel soreness after the training, it's actually you are causing some very, very minor tear in your muscle in order to grow the muscle. So I think the normal soreness is actually usually lasts for maybe 24 hours to 72 hours, and then it would be better when after stretching. And if it is a sports injuries, you will find that you will feel pain when you trying to massage it, and then you stretch for a long time, and then you still can't let the pain is still sustained. So I think the timing of the pain, and also if you can relieve it after days, I think that would be normal soreness. If it's a sport injury, it won't resolve it by purely stretching. And yeah, and that's it. Does that answer your question, Joy? Yeah.
Um,
Okay.
Okay, we have one more question. It says that you seem very passionate about sports and it's really inspiring. They're wondering if you have a story behind your passion for sports and if you have any inspiring things to share with the youth who are interested in sports related things as well.
Thank you for the information. Thank you for your questions. Actually, I was an athlete, and I have been learning this. I have been studying physical education since I was Form 1, which is grade 9. And so sports have not been, is always with me. And then when I have a lot of stress, and then sports is always the way to resolve it. So I think like this is I'm inseparable with sports and also at physical educations. So I think what I want to say is sports is you would never find a thing that gather people around, especially when I'm going older, and then people just work for different things. And I think you need to cherish the time that you still have friends to play basketball with you, play some team game with you. I think it would be the most beautiful memory for you guys. And if you are into building up as a habit, or you aim to be an athlete, you need to know working hard is not the key things. Working smart is the key role to be an elite athlete, because I have met a lot of athletes throughout my athletic career. Like some of them just work really hard, they train every day, but method just wrong, and then their diets just go completely inappropriate, and that's why they never come during the competition, they never perform really well, even they pay so hard. And the other hand, for some people, they know that they know more about their body, they have knowledge how to prevent injury, they know that how to optimize the timing to train, and then what is most efficient to train. And this is the way to be a professional athlete. So you need to be smart to train, but not working hard only. So I think you really need to be clear of that, and avoiding all the insufficient way to waste your time. Yeah, so I think that's it for I think that's my key message. Train smart but not train hard. Okay, yeah.
I have a question. It's kind of like really specific, though. Is that okay?
Yes, yeah, sure.
Yeah, so like recently, like 3 months ago, I got like diagnosed with this thing in my ankle called like a bone marrow edema, if you know what that is.
Sorry, can you
Oh yeah. It's called like bone marrow edema. It's kind of like on like yeah. So it's on my ankle like area on the cuboid, I think. And so like the doctor basically said that like I just need to rest for 3 months and then I can like play sports again. But then like after 3 months, it's still not healed. And but like if in order to be on my sports team, I need to continue to train. So would you like suggest me to continue to train and like not rest it, or like kind of like rest up and then um you know like let it heal and then do sports?
I think you have injury on ankle, right? And then for your cases, most of the protocol that's really suggesting rest as the main treatment for now. But I think in terms of the rest, you need to differentiate. You have rest for ankles, but then you can also train for other part of your body, and also for the same side of the ankle you can train your your front, your other part of the leg, right? You have knee training and also for the thigh. I think you need to keep the muscles working, but not exactly or moving the side that you got injured right now. But you can do the some minor training like swimming to keep the cardio, and also some muscle training to keep other part of the muscles that still have the strength. So after you take rest, then other part of the body is actually ready for that. And for the calf muscles, you can actually just do mild range of movement, but not just wait. Don't wait there on it and do movement. Just move your ankle a bit to keep it stretched. And I think that would be what we need to do right now. Keep other part of your body, get ready, prepare for that, and while you're resting your ankle or calf, yeah.
Wait, do you know if there's like any way I can like kind of relieve it, or like other than resting, is there like any way to like cure it or anything? Like I've heard people say to like apply like heat cream and stuff, but like do you know if that would only help like how I feel, or will it actually like heal it by like reducing swelling?
I think to reduce swelling, I think you need to kind of feel the temperature of the ankle side. Use your back of your hand to feel it's the most accurate. If you feel like I think the temperature is kind of change time to time, right? You don't feel inflammations throughout the day, or it feel you get better at some times of the day.
Um, like for me, it only starts hurting like when I run a lot, or like maybe like a few hours after I run a lot that day, then it'll kind of hurt the next day. So it's not like immediately, like like it doesn't hurt immediately, and like yeah, but I don't really notice the temperature change.
Yeah. So if you feel that the heat is at the temperature of your ankle is higher than the other side, then you can actually apply ice to reduce the inflammations. But if you feel like, oh, the temperature is around the same, but you still feel the pain, you can actually do some stretching, or you can use the massage gun to try to add some vibration to promote the circulation there, and then also to release some tensions over the calf muscles. I think that would be the pain relief method for you at home. Yeah. But if you want the specific treatment for that, then you need to have the maybe acupunctures or other facial release method. That would be more professional way to treat your ankle. But for general home exercise, I think that would be it. Yeah.
Okay. And do you think it's like a good idea to apply heat cream? Because like I don't know, someone told me to apply heat cream like before bed and just wrap my leg with it, but like I'm not sure like if that's like a good method.
You mean heat cream or what cream?
Yeah, like heat cream.
I don't think I think heat cream is usually warming up our muscles when we are before game. So I don't think like if you are resting, you're required to use the heat cream to increase the circulations.
Okay, I understand. Thank you so much.
You're welcome. And for Holly, that he direct messaged me. Why do I want to be a physio? Because I have a lot of injury myself, and I do have a lot of experience. And also, I feel like after being an athlete, I have saw too many people going to on the wrong way. So I don't want the other people to repeat what I've done. So that's the reason I want to become a physio.
Hi, My name is Cyrus, and I'm a basketball player and a ballet dancer. So recently, I've been dancing a lot, and my Achilles is getting very sore. So, do you have any advice for me?
Sorry, there was like one question. Could you repeat that?
Sorry. Can you continue with your questions?
Yeah, so my name is Cyrus. I'm a basketball player and a ballet dancer.
Mm-hmm.
Yeah, so recently I've been dancing a lot, and my Achilles is getting very sore. So, do you have any advice for me?
Mm-hmm. I mean, just one side or both sides?
Just the right side.
Do you have any injury before?
Not any major injuries.
Yeah, I have you tried to do some stretching as well?
Yeah.
Okay. I think you need to if you have some soreness of your calf, I think the general method is stretch and then and if the pain is sustained or and localized it only on the ankle, the heel bone, and then you might need to kind of reduce the dosage of the training to see if it's get better.
Okay, thank you.
Thank you so much for your sharing. We're really grateful for your time, and I'm sure we're all super like enlightened, and we've all learned so much. We really enjoyed your presentation. So I think we,
Thank you.
yeah, thanks so much for coming, and for your time. So I think we can like move on to the next speaker as well now.